Health officials in British Columbia have detected what appears to be the second case of the new South African variant of COVID-19 in Canada. The province's top doctor says the case is not travel related, and officials are trying to pin down where the infection came from. Not much is known about the new variant, but like the other variant in the United Kingdom, it appears to be spreading more easily. Now, with more on this, we're joined by Dr. Raywat Deonandan, epidemiologist and associate professor at the Faculty of Health Sciences at the University of Ottawa. Good afternoon, Dr. Deonandan, and thank you for joining us.
Thank you, Miranda.
All right, so let's get right to it. What can you tell us about the new South African variant?
It's troubling. So it seems it might be able to evade the natural immune system a bit better than the classic prevalent variant. So it's important that we do not allow it to spread further. Right now, it seems that the experts agree that it probably can respond well to our existing vaccines, probably, but we don't know for sure. It has to be investigated. But we have to prevent additional variants from emerging and from becoming dominant. So it really underlines the importance of getting the vaccine out there as quickly as we can.
All right, and Dr. Deonandan, switching gears now, an Ontario politician wrote a letter to the Premier calling for an end to the lockdowns, claiming that they are deadlier than the virus. Now, he also claimed that the lockdown is grounded in false public health narratives. So how dangerous are these comments?
Well, it's unfortunate that he made them. Mr. Barber has been actually a strong advocate for COVID response earlier on in the pandemic, so this is an unfortunate development. His letter is interesting, and a couple of things aren't wrong. For example, I think better planning probably could have avoided much of the suffering we've had economically this past year, and planning involves things like strengthening our long-term care systems, having better testing and tracing protocols, etc. However, I think it's false to say that it's based on poor public health data. The data is pretty good. In fact, we saw some of it in the modeling released this last week. And the threat to the healthcare system is dire. This is not just about COVID affecting COVID patients and causing death in that way. If we threaten the ability of the healthcare system to respond, that's a pillar of society. The healthcare system underwrites so much more, the economy, businesses, jobs, etc. So we really have not got a true sense of the chaos that would result if we allow that to happen. So I think the letter underestimates the true impact of COVID if we were to let it run amok.
Okay, and Dr. Deonandan, federal health officials updated the timeline guidelines for the second vaccine dose, saying provinces can likely wait as long as 6 weeks without impacting the effectiveness. But Quebec will allow a 90-day delay. Is that concerning?
It's curious. If you'd asked me a few weeks ago, I would have said, no, don't do that at all. The clinical trials clearly say that there is no evidence to support that conclusion. However, we're in a new dynamic right now. The new UK variant will become dominant here in a couple of months, probably. We have to get ahead of it, meaning we have to get our long-term care residents and our retirement home residents vaccinated as quickly as possible. So it makes sense strategically, I think, at this point, to pull out all the stops to allow that to happen, including possibly lengthening the time in between doses. So will it compromise immunity? Nobody knows. The virologists seem to think that it probably won't, but we're all crossing our fingers here. Remember, we're in a race here against the new variant, and that's what's driving these decisions.
All right, thank you so much, as always, for your insight and expertise. We appreciate your time. That's Dr. Raywat Deonandan, epidemiologist.
Thank you.